Hi, this is Demetria Clark from Birth Arts International. Today, we're going to talk about what is a doula. To find more information on how to become a doula, you can visit us online at www.birtharts.com. So, what is a doula? A doula is an experienced non-medical assistant who provides physical, emotional, and informed choice support and prenatal care environment. So they assist women with questions that occur during pregnancy. They also assist them with nutritional information, breastfeeding information, and care and comfort measures and support during the actual labor process. They are highly trained professionals. In Birth Arts International, if a doula takes our program, she is going to, at a minimum, attend 5 births, read 10 additional books, and complete a 450-page educational guidebook that includes activities from care and comfort measures to making handouts, business development, ethics, communication, and so much more. It's crazy all the work that these women do to support the women that they care for in their community. It is just so inspiring and so lovely that these women are so dedicated to their profession and willing to make the sacrifices that it takes to really assist with infant and maternal mortality standards getting better in the United States. And they are really doing their part. A doula offers continuous care, and she is a continuous care provider for the labor. And in many settings, this doesn't occur. Women are no longer assigned a nurse who will stay with them until the beginning, from the beginning to the end of labor. And in a home birth environment, it's not that the midwives aren't able to always do that, but sometimes they need to be doing other things also. A doula can also assist with family care in a home birth environment. She can assist with helping the mother bathe during labor, getting in and out of the tub. There's lots of things that she does that have initially in a client's mind not much to do with doula care, but it's really all part of the job. So doulas work in many different labor settings from home birth, birth center, and hospital birth. Most people think of doulas as being the most effective in a hospital birth setting because that's where you hear about them the most. But there's testimonials and there's birth stories that say that doulas are beneficial and lovely in any birth environment. So, why is a doula a benefit to a birth? Why is it important to have her at a birth? Well, there's some studies that have been done, and the most common one cited was by Kennel Kloss and Kennel in 1993, and there have been updated and revised ones, but they all essentially say the same thing that this groundbreaking initial study said, that when a doula is present, women have up to a 50% reduction in cesarean rates. In the United States, our cesarean rate is almost double what the World Health Organization says is an acceptable rate, and in some places it's even much higher. That the mothers who have a doula have a 25% shorter labor. A lot of women do not know that initial labors for first-time moms can easily be 18 hours long. The way that birth is done in our country, we like everything to be instant. You know, we got Instagram, we got the Twitter, we've got Facebook, we've got, purchase something from Amazon and it's here in less than 24 hours. Birth is not like that. Birth has its own schedule. And a doula can assist you in maintaining and feeling good about the schedule that your body and your baby are on. Women who have doulas have a 60% less chance of requesting an epidural. And of course, if you decide to have an epidural epidural, you are still going to need doula support. A lot of people think that, well, if I have an epidural, I won't need a doula. Well, actually, in some cases, you need a doula a lot more. Your mobility is limited. Your response to your body may need a little bit more. You may need someone to assist you with following the normal path of your body because your body is reacting and responding to the drugs that you've been given. There's a 40% reduction in oxytocin or pitocin use. There's a 30% reduction in the overall use of pain meds and a 40% reduction in forceps delivery. Forceps delivery is not something that is still commonly done in the United States, but it is in other places in the world, and at times it's done, and it's done too aggressively. So that is a number that we should feel proud as birth care providers that we can assist women in bringing down. So if you want to hire a doula, you can visit Birth Arts, and we have a list of doulas that are currently working in our program. And you can also email us because not all doulas are always listed. They've either haven't gotten around to doing a listing, or they have too many clients and they don't want too many listings about, so we can also help you find someone who's in your community. So, questions to ask a prospective doula that you're getting ready to hire. You can ask her what kind of training she had. There are lots of wonderful doulas who have all different kinds of training from all different organizations. Of course, I think Birth Arts is the best because, I'm the director, I'm supposed to. But there are lots of wonderful doulas out there. And the important thing is to not focus on a brand name of a doula, but focusing on a doula that you feel comfortable with and that will work with you. Ask what the doula can provide. Does she provide prenatal or postpartum visits? How many of these visits can you expect? Is she accessible to you? Are you going to be able to call her? Does she have references? Take a look at her website. Ask her what kind of births she's gone to. Has she witnessed a cesarean and epidural, an intervention-free birth, a VBAC, a teen birth, maybe the same kind of birth that you're looking for. Ask her about her fee and if she has a sliding scale or payment arrangements. Some doulas do not offer a sliding scale, and some doulas do not offer payment arrangements, and that's perfectly acceptable. If you decide that you don't want to pay for a doula, and that you want a free student doula, you also need to fully understand what that means. Sometimes paying for the service is going to definitely guarantee you a higher level of professional support. And as a parent, you need to understand that when you hire someone who is a student, they are just that, a student. I would not let price dictate whether or not you're hiring someone. How many births has she attended? Has she worked with a care provider where you're going to be giving birth? Does she have backup available? What will her role be in early labor? Some mothers want lots of support in early labor, and some mothers don't. So make sure you have a doula that you feel, if you want her to be there in early labor, that she's definitely able to do that. Or if you decide at the last minute you want someone, that she's flexible. Or if you decide you don't want anyone until you're in full labor, that's fine too. You need to find what works for you and find a doula that can work within your parameters. And be very clear with her. And she will be able to be very clear with you. If you do not ask a question and you are looking for the answer, then that means that there's a miscommunication. So make sure that you do your best as the parent or the care provider to effectively communicate. And how many methods of childbirth is she familiar with? And then how does she define her role? Having a doula can be a wonderful experience for a family. Having a doula, I have had many women say, I would have paid 3 times what her fee was if I had known. And we need to remember that hiring a doula is an investment into your birth story, into your memories, into the way you remember your birth. And it's also like an additional insurance policy when you look at the reduction in cesarean labor time, the cost of drugs. When you think about the financial aspect, a doula is quite a savings and potentially can save you a lot of money, especially if you have co-pays or only a set amount that's being able to be spent on your birth. So if you have any questions, you can email me at Demetria, Demetria, at birtharts.com, or you can visit BirthArts online at birtharts.com, or you can call us directly at 866-303-4372. This is Demetria Clark, the BirthArts International Director, and I hope that you've learned something from our What is a Doula question today. Thanks. Bye-bye.